Doctors from the Singapore General Hospital, or SGH, have pioneered a new way to treat chest deformities by using 3D printed implants. This is the first time in Singapore a 3D printed implant was used to treat pectus excavatum, as a condition commonly known as sunken chest. Patients usually undergo a minimally invasive surgery known as the NAS procedure. This improves their breathing and cardiac functions. However, it may not sufficiently correct the physical appearance of chest deformities. And that's where the 3D printed implant comes in. On this, we're joined by Dr. Chew Khong Yik. He's senior consultant at the Department of Plastic, Reconstructive and Aesthetic Surgery at SGH. Dr. Chew, if I could just run through this very quickly. The NAS procedure involves, very broadly, an insertion of a bar that pushes the sternum or the breastbone outwards. And then after that has been corrected over a period of time, you then have to fill in, either using fat cells or synthetic implants, the sunken pockets around that sunken breastbone, which is now no longer sunken. And 3D implants, where does that come in this entire procedure?
So if you can imagine a sunken chest, it's almost like a CPR process. Yeah, so when you compress the chest, in these kind of individuals, the chest is permanently being compressed. And this NASBAR procedure was invented in the 1980s to sort of reverse that CPR procedure by pushing out the chest bone by anchoring the metal plate against the ribs, and hence expanding the lung and allowing the lung to breathe properly. So although it corrects the functional problem with these sunken chest deformities, frequent times the deformity is severe enough that externally they still have residual deformities. And that's where we in SGH come in to try and solve the residual cosmetic or rather external appearance problem.
So how does this 3D implant work? You place it in, it is absorbed. How does this work?
So the process involves firstly doing a CT scan of the chest, and by mirror imaging the normal side versus the abnormal side, you can sort of calculate what is the exact deficiency and what kind of correction that you require so that you achieve symmetry. So the 3D planning is the first part. And the second part of the ingredient is to print this specialized material. This implant is porous and allows us to engineer bone by using the patient's own bone marrow. And by seeding the bone marrow into the construct, will then allow the bone to grow, while this special implant will undergo absorption over the next 2 years.
Dr. Chew, I take it, as you mentioned, this is largely a case of trying to create symmetry between two parts of your chest. But the first part, which was this NAS procedure, was, as you mentioned, to improve cardiac function as well as breathing difficulties that you may get because your chest is too sunken. Is it possible that with advanced technology and better surgical procedures, at some point we may just forego the NAS procedure altogether and just rely on 3D implants?
Yes. So firstly, most cases with sunken chest may not require this invasive procedure where the bar is inserted into the chest cavity next to the vital structures. For these milder cases, we can use only the 3D implant. For more severe cases, I foresee in the future with 3D corrective procedures, we can form some kind of a splint. And perhaps this can be given to the patient when the chest is still undergoing development. And by molding the chest cavity and the chest wall, we could foreseeably see some kind of a correction. But of course, this involves much research and planning. But I foresee that with advances in 3D printing and planning, we will get there.
Well, thanks very much indeed for all that, Dr. Chew Khong Yik. He's senior consultant at SGH.